Hi, my name is Victoria Deardoff, and this is my presentation on an elective course for curriculum design with Dr. Frucci. My course is entitled Nurses on a Mission, and it is a proposal for an elective study abroad program. Let's get started. So the course description. This course is designed to fall between the fall and spring semesters as Oklahoma City has a 6-week break. The proposal is to have a 3-week intensive that falls in that period as the students will have completed their community health and will be going into leadership in the spring. This course is really finding the heart of that transition to practice by pushing students in their nursing scholarship while developing some psychosocial skills, self-care, and really preparing them in resiliency for their practice. So this 3-week elective leadership course will expand upon the students' knowledge of client care and community health by facilitating the development of public health teaching to a local and global audience. Students will work in teams to survey, identify, develop, and implement needed teaching to the Oklahoma City Rescue Mission, and again, internationally with Oklahoma City University mission partners, such as Oxana, Mexico. Abroad, students will utilize the course text, The Mindful Nurse, by Carmel Sheridan, to reflect on personal and clinical experience to introspectively define their mission or their reason for becoming a nurse. And then this is my final one. If we have any questions, because I'm doing this asynchronously, I put a QR code right here. So if you wanted to scan that, it goes to a Google survey where you can type out your question. Be sure to include your email, and that's how I will respond to your questions. I hope that this was an informative course. I was really excited coming up with it. I think that it could truly be a really life-changing experience for students. There's something so special about being able to travel abroad, just to see and get out of your shell of how the world is and how people are in their home environment. So I hope that it's something that can come to fruition. So the significance, there's ancient Chinese war generalist, Sun Tzu. He stated in his book, The Art of War, victorious warriors win first, then go to war, while defeated warriors go to war first and then seek to win. And my interpretation of this is it's really speaking towards the importance of preparation. The nursing profession is fraught with burnout, as we know. And there is a lot of surveys, but one that I found significant in 2021. It was an online survey for 200 registered nurses. It was conducted by Hospital IQ, revealed that 57% of new graduates, or those that had been working their first 2 years, plan to leave their position, and that 90% of the nurses that were interviewed were considering changing their profession within the next year. This is a staggering assessment, and I think one that those of us that are still bedside are feeling intimately, even in education. There's a lot of burnout and there's a lot of hurt in our profession. So these numbers reflect a desperate need for all levels of nursing education to implement a multi-level support and prevention for burnout. Long before COVID, the National Council of State Board for Nursing, or NCSBN, organized a committee and completed a report in 2008 outlining the importance of implementing a formal program to help transition new graduate nurses to the workforce. This transition regulatory model is the synthesis of that research, and it depicts an evidence-based step to recommend and help protect the public by preparing new grads for successful practice. As we know, new graduates are at risk for making medical errors. Those medical errors are then inflicted on the public, and if we're having a large part of the population as new graduates, it is a public health. It's something of concern. So they recommended having specific steps. So nursing education cannot prepare new graduates for acculturating into their workplace. Necessary skills are being self-aware and learning about team dynamics, leading teams, coordinating care, managing conflict, understanding psychological effects of change and transition on themselves, communication, and evidence-based practice in their systems of thinking and financial pressures. So they identified that the new graduate is going through a significant transition and is in need of significant support. And this support needs to come from the hospital institution that the student will be working in at post-licensure, but also to bridge the gap from the educational institution. They concluded with this report that the new grad without dedicated systematic support systems were more likely to make medical errors and thus become a danger to the public. Similarly, the Quality and Safety Education for Nurses, or QSIN, initiative lists the collaboration. Give me just a second. So they had a similar list of initiatives that include leadership, patient-centered care, and communication as the key skills for the new grad success. It's imperative that nursing education prepares the new grad holistically. Students must thrive academically as well as psychologically and spiritually. As Jean Watson famously stated, caring is the essence of nursing. And it's my belief, and I believe the belief of this program, that students need to care not only for those patients, but for themselves. And by caring for themselves well, they are then able to care more significantly and better and have resiliency and retention for working in the hospital and caring for others long term. This course will help students find their mission for nursing by integrating key leadership and self-care skills, by immersing them into complex populations in need. The winter intensive course allows students to focus solely on their mission as they'll be traveling abroad. This course is unique in its focus on self-care and mindfulness as students live amongst and survey the population. By combining nursing practice with mindfulness, the course will simulate and prepare the students for the work post-licensure. The students will reflect daily on their nursing activities amongst the population, learning important resiliency skills. This course will help bridge the gap between the Kramer School of Nursing program and the new grad's first position by preparing them holistically. This course reflects the Kramer School of Nursing program outcomes and fits into the current program outline. As the winter intensive and travel abroad course, it allows concentrated time for reflection and mindfulness activities that the didactic course may not be able to accommodate. Finally, this course reflects the Oklahoma City University Methodist tradition for outreach through volunteer work. So some course details. The credit hours, it's going to be 3 credits, and this is reflective of other KSN elective courses such as spirituality and healthcare and becoming a healing presence, which are wonderful course ideas. And I kind of got inspired by those elective courses, the study abroad one that's already offered, and then the spirituality and the healing presence, and kind of being able to combine both of them. It really is such a unique opportunity to be abroad with students, having that intimate relationship and the time outside of the classroom. Really brings that post-conference into a whole new level. So I was excited and thought that this would be a unique opportunity. It is also, the 3 credit hours is reflective of other Oklahoma City University study abroad programs such as the Shakespeare in Rome and tropical biology. there is a potential that the credit hours would differ depending on if it can be a clinical opportunity, clinical hour opportunity, as the Oxana, Mexico trip currently offers. The pre or co-requisites, just depending on where it falls in the, if it was to be a summer course, for example, the students would need to be enrolled in the Kramer School of Nursing and have good standing and progressing, that they, passed their courses previous semester and are in good standing. And it really is important that they've had community health or are currently taking community health. I think it's possible for them to be taking community health, but it would, I believe, not be as meaningful of an experience. Eligibility, just having a current passport, up-to-date vaccinations. You don't know what the COVID vaccination or booster would look like. That would be something to figure out. And then the cumulative GPA and the 30 credit hours, those are requirements from the university for the student to be able to study abroad. The required reading is that The Mindful Nurse and the Power of Mindfulness and Compassion. The reason why I selected this text is because it's a really cool workbook that helps students to work through what they have witnessed, what they want, how they see their nursing career. I think it could be an excellent opportunity for students to sit down together with their faculty member independently and kind of work through those questions. Other materials would be that public health book. This is an example that I got online from Elsevier, but whatever book is utilized by that course. And then an additional reading that could supplement, faculty could have excerpts from it or read excerpts from it to the students, but I wasn't strong like this when I started out. What's cool about this one is that has little vignettes. Each chapter is a different kind of nurse, a different experience, and how they built resiliency through their career. Okay, so why this textbook? I kind of got into this a little bit earlier, but The Mindful Nurse is a wonderful book that has gotten a lot of accolade, including from the American Journal of Nursing. They said it's one of the top 3 textbooks that should be included in every nursing program. And it's, as I said, a great tool for reflection and kind of practicing those self-care techniques, mindfulness and resiliency, so that you are continuously giving compassionate care throughout your career. As we know, kind of the definition of burnout is no longer caring about that individual and just kind of going through the motions, which is the last thing any of us want for ourselves and for the nursing care. And so, again, by kind of coupling the self-care concepts with the nursing scholarship of having a study abroad community health program, it's really pushing the students into being that independent leader, of developing the program, and then having that chance to step back and reflect on what they did that day. Okay, so these are the Kramer School of Nursing program outcomes. They are reflective of this course. That course was kind of in a backwards design of what are the things that we want the student at the end of the program to be able to do, and how can I get them in a creative and fun way to accomplish that. So these are the learning outcomes that I identified for my course. So on completion of the course, the student will be able to demonstrate cultural sensitivity through interactions and volunteer work with their assigned outreach organization, whatever that organization is, as previously discussed. And this is for the length of the course. And so this also reflects the American Association of Nurses of Domain 2, and the program outcomes 1, 3, and 6. The second one is developing interprofessional relationships by participating in volunteer work with assigned outreach organizations during the length of the course. And then develop leadership skills by working in student groups to develop and implement learning activities successfully by the end of the course. And practice self-care by participating in mindfulness exercise and reflections as guided by the course text. So the students will utilize their knowledge of community health nursing to assess community to determine the needs, then develop an individual education plan to teach that topic. Placed in groups, the students will demonstrate leadership and communication skills as they implement the various stages of their projects. Students will need to demonstrate cultural sensitivity during their assessment and implementation of the teaching needs, as the person's culture can affect their learning needs, this such as the language that they use, the appropriate metaphors that they would use, respectful body language, etc. To develop an effective teaching plan over appropriate topics, students must synthesize the knowledge from previous courses. So that's kind of where those outcomes came from, and then why I chose the project that I did. So teaching methods, the debrief for meaningful learning is one of my absolute favorites. Teaching methods, as it really gives the students an opportunity to deeply reflect on their experience. The experience being the program design, as I'm going to get into, but also just their experiences in general. I think that this type of course really allows for those intimate moments of maybe sharing a moment from childhood, a reason why they're trying to find their reason for a nurse, what their calling is, for why they chose nursing. And so by debriefing for meaningful learning, it gives the students an opportunity to think back on what they did during their presentation, how they can do it better, and why it matters. So it's typically seen for simulation, but the reflection questions apply to any experience. And so along that same lines of using DML, having faculty-led Socratic type discussions. So I think it's important that they're kind of student-led, and that they're able to share what they need to share from that day, from what they're reading and what they're learning. I think that it's also important that the students are developing those leadership skills by coming up with activities for the group themselves. So my idea was to have a morning and an evening kind of reflection times throughout the 3 weeks. So sometimes it can be some journaling, sometimes it can be faculty led, sometimes it can be student peer led. Just kind of having different opportunities for the students to reflect and kind of grow throughout the 3 weeks. And so there's this is a quotation from John Dewey, who is a philosopher, and he really had a big impact on education reform. We do not learn from experience, we learn from reflecting on experience, which is a very insightful statement and has had a lot of impact on transformational learning. Okay, so evaluation methods. There is no point in it being a course if we're not able to evaluate why, if the students are being successful. So there is a rubric for the public health teaching. Having debriefs for that, debrief for meaningful learning, a daily journal, and then adopting the clinical performance evaluation. That clinical performance evaluation is important for twofold. One, if the students are able to use those clinical hours, it's important that we have a standard across the program. But secondly, a clinical performance rubric is designed as a kind of participation and kind of fulfilling the actions. So it's very useful in this instance where the students mainly will be working one-on-one and volunteering with their outreach program. Okay, so debriefing will help students through the reflective process, reflection in action, on action, and beyond action. This process will help students develop clinical judgment and clinical reasoning to be able to think and act like a nurse. Those 6 phases will be engage, explore, explain, elaborate, evaluate, and extend. Bajork and Kirkevold had a study, and their conclusion was if the new nurse cannot get feedback on their practice, along with an opportunity to reflect, their practice will not improve. And so the daily journal assessment or assignment will allow students to kind of reflect independently, as well as they will be reflecting as a group. Um, Yeah, so we'll get into the teaching rubric in just a second. Okay, so this is my learning unit. So as kind of hinted at, the main project of the course will be to do a teaching project for a local and then a global um, population. So local being in this kind of proposal that the Oklahoma City Rescue Mission, so with the homeless population, I want the students to utilize the Pew Research Center's methodology for surveying and developing a questionnaire to assess population needs. So by that population survey, they're able to identify what that population learning need is. So whether that's cigarette cessation or wearing a mask or wound cleaning, things like that, they're able to identify a top learning need from that population. And then they're going to develop a teaching plan. So, assessing their resources and the learning needs of the students or the population, they will develop a relevant teaching activity for their topic. So those are kind of fancy words for saying, okay, what do I have here that I'm able to use? And what do we need to teach? Um, and at the same time, being culturally sensitive to what they're going to teach. For example, with the homeless population, it would be inappropriate for them to say, um, you know, access this video via the internet when they may or may not have access to that. It would be putting a barrier, and it's important that the students are culturally sensitive and equitable for the population that they've identified. Then they're going to implement that project. They're going to teach it themselves, and they'll present their learning activity to that population. So it's not just a presentation talking, but there's an activity component with it. The students are going to be working in groups. Kind of honing in on those leadership and communication skills. And then we will debrief using the DML model after each presentation that they do. So they're going to, again, be doing it locally and then globally abroad. Okay, so the next steps being of if or when this course can be implemented. So I think it's important to survey the student interest. It'd be utilizing a lot of resources and time of faculty if the students were not interested in a program like this or didn't feel that that winter break, for example, was a realistic time period for them to go. There wouldn't be a purpose in developing this course. And then it's important to contact the current mission partners to see if this is something that we can kind of adjust the lens on. For example, utilizing that Oxana, Mexico trip and kind of shifting the perspective a little bit. Or you can have potential partnerships with other universities. As mentioned before, Liberty University has a long-standing relationship with several abroad programs, and it could be cool to see how they go about implementing this program and offering it to their students. A way that we could learn is doing a faculty shadow on a different university's trip like this, just to see how they do it, what works, what doesn't work. Yeah, no reason to reinvent the wheel. So some potential challenges that we could have in implementing this course. I think the biggest one is going to be the equitability. So the cost, it's an additional cost to the student. It's an elective course, so it isn't necessary for their graduation. It's to supplement or enrich their experience, but it can create a deficit for the students. Transfer students may have a hard time meeting the university standards for study abroad by not having those 30 units, for example. And then international students may kind of fall in that same boat of having some difficulties meeting the university's standards for an abroad program, as well as visas, etc. There could be travel restrictions as we are just kind of budding out of the pandemic. It's difficult to plan something like this, and hopefully it's something that can be implemented. But that is something to definitely be aware of. Faculty availability, being able to go with the students, having enough faculty per student, whatever that looks like. And then the biggest challenge is developing a reliable international relationship, being able to go out wherever it is, and actually being able to do what the course intends of having a volunteer opportunity as well as the host families and it being safe for the students. Um, and then working within the international nursing scope. So um, setting up our students for success internationally. And then this is my final one. If we have any questions, because I'm doing this asynchronously, I put a QR code right here. So if you wanted to scan that, it goes to a Google survey where you can type out your question. Be sure to include your email, and that's how I will respond to your questions. I hope that this was an informative course. I was really excited coming up with it. I think that it could truly be a really life-changing experience for students. There's something so special about being able to travel abroad, just to see and get out of your shell of how the world is and how people are in their home environment. So I hope that it's something that can come to fruition. Okay, thank you very much. Here are my references.